name is Tatiana. I'm the mother of a 14-year-old boy who was diagnosed with ADHD. And so I sought the help of a biomedical doctor well known to treat this problem. And we went through everything that Diego was doing. And it seemed like a lot of it was already good, but he needed help in one area, which was in helping to activate the brain. We had done a SPECT scan, which shows how the brain is working. And in his particular case, we had found that the brain was inactive for a major part, especially the frontal cortex. And so paying attention for him was very difficult. And so my question to this doctor was, well, how can we activate the brain and without using drugs? And he said, hyperbaric oxygen therapy. He explained to me that by doing this therapy, more oxygen would come into the brain and it would on its own become more activated. I was pleased to find that something could work, but I wanted to see if it really could. Originally, the doctor told me that it would be about 40 sessions that would be needed, and I probably wouldn't see results until the 20th. However, I found that we were having results within 1 week of starting this therapy. It was incredible. He not only was paying more attention, he had more stamina, more mental stamina to deal with situations. He wasn't getting as angry. He had more patience to deal with things that he didn't get right away. He started being happier as he was able to better communicate with other people because his anger and his impatience weren't getting in the way. And in general, his life changed. It's not just about paying more attention, more focus. It was about being able to be himself more. And this is what HBOT has done for my son. By the time we finished the 40 sessions, he was a different child. His grades have gone up. In the one summer we did this, which was last summer, prior to doing HBOT, he had C and D's as his grades, even though he has been tested as a gifted child. After we did HBOT, his grades were almost all A's except for one, which was physical ed, which he's never really been a physical kid. So you can imagine how what an advocate I am of this therapy. When I sought out hyperbaric oxygen therapy, I was looking for places near me, and there was actually a few places that I was able to go to. The first one we tried, I thought they were fine, but I didn't think that they were particularly versed in my child's condition or had the experience of treating a child per se, or preteen in my case. And the problem with that was that I felt that the buy-in on my son's end wasn't completely there. And so after a few sessions, I looked for another place, a place where I felt would be more comfortable for him and perhaps where he would have more attention as a child instead of just as someone seeking hyperbaric oxygen therapy. And so I ended up here, and immediately my son bonded with Brian, and Brian took the time to explain to him how things worked, why it worked, and also listened to my son's questions. And so I think my son felt listened to, heeded to. And because he felt that way, he also heeded to whatever Brian was asking of him. And this was actually vital in getting his cooperation. I find that this particular place has the qualities to cater to that, and to children and to families that have more of a wholesome approach to all of this.